Hello everyone and welcome back to another video. My name is Dr. Alex Goichman and today I want to talk about the dangerous fear factor and the silent numbers of this outbreak. We are in week 3 of stage 4 COVID restrictions here in Melbourne and I hope you've been keeping well and healthy. Since January this year, our lives have been revolving around daily numbers. Numbers of infected, recovered, dead, and any other figure which is relevant. I don't recall any time in modern history where so many lives and livelihood have been directly affected by numbers. However, today I want to talk about another set of numbers. Numbers which also carry a direct impact on our lives and health, yet these numbers don't get any media coverage. In my line of work, I noticed that around April, roughly the first lockdown, we started seeing more and more people with broken teeth and deep caries, which in many cases required complex treatment. When we interviewed these people, many of them reported that they started having symptoms a few months ago, early in the year, yet due to fear of COVID, they chose to avoid going to the dentist. Roughly the same time, I started hearing from other people who work in the healthcare system that hospital wards and clinics, which deal with specific health conditions, report unusual low attendance. Now, is it possible that fear of catching a possible condition prevents people from dealing with an existing condition? Is fear of the unknown so strong that it prevents so many people from dealing with a known problem? Back in April, data was still scarce. However, towards mid-year, I started finding more and more statistical reports from health institutes around the world which shed light on this global yet human fear factor. I wanted to share some of these reports with you, and as in my previous videos, I attached links to these reports at the end of my email for those who want to read more. The first article I want to talk about was published on the 6th of June 2020 by a group of emergency doctors from the Netherlands. It is titled Non-COVID-19 Visits to Emergency Department During the Pandemic: The Impact of Fear. What this group concluded, and I quoted from the article as is, it has indeed been reported that patients delay seeking emergency care because of COVID-19 fear. Another paper published by an Italian group on the 27th of April this year compared hospital emergency admissions and discharges between equivalent periods of 2019 and 2020. The title of their paper is The Emergency Department in the COVID-19 Era. Who are we missing? Now, in this graph which you're seeing in front of you, it is taken from the article and it summarizes the total admissions to hospital emergency, where the height of the columns represents the total number of people who approach the emergency department, and the dark gray area on the bottom of the column stand for the number of people who were actually hospitalized following emergency care. This graph is broken down into different periods and years. It is astonishing to see the difference between 2019 and 2020 in regards to the numbers of people who approached hospital emergency. Now, this second table shows a more specific breakdown of the main reasons for which people were actually hospitalized. And again, we can see the differences between 2019 and 2020. However, one interesting figure which has surfaced from this work and is hidden in this table is that most numbers have dropped between 2019 and 2020, except for pneumonia, which is associated or can be associated with COVID, and depression. Hospital admissions due to depressions have actually risen by 22% in 2020 compared to 2019. Another group, this time from Germany, looked into decline of emergency admissions for cardiovascular and cerebrovascular events after the outbreak of COVID-19. What this group found is that hospital admissions for immediate heart attack and cerebral stroke were no different between 2019 and 2020. However, suspected or symptomatic admissions have dropped by an average of 30%. Now, just to clarify, suspected or symptomatic are all those preventable cases, which means that by early diagnosis and treatment, acute or fatal conditions can be prevented. Another Italian study, which specifically targets this critical situation, was published in July 2020. It is titled Reduced Rate of Hospital Admissions for ACS, stands for Acute Coronary Syndrome, during COVID-19 outbreak in Northern Italy. This article found, and I quote word for word because I believe that their wording is powerful. So listen carefully. This report shows a significant decrease in ACS-related hospitalization rates across several cardiovascular centers in northern Italy during the early days of COVID-19 outbreak. Recent data suggests a significant increase in mortality during this period that was not fully explained by COVID-19 cases alone. This observation and data from our study raise the question of whether some patients have died from ACS without seeking medical attention during the COVID-19 pandemic. This study actually suggests that this group found an increase in preventable mortality. And finally, I want to share with you a joint publication by Stanford University in California, Ogaki Hospital in Ogaki, Japan, and the National University Hospital of Singapore. These centers reviewed the numbers of screening and follow-up appointments in specialist clinics dealing with liver malignancy and cancer. Now, the graph that you're seeing in front of you compares the data from 2018, 2019, and 2020. This graph was taken from the article. And as you can see, this graph displays the total number of visits broken down to months and years, where blue stands for Stanford USA, orange is Ogaki Japan, and gray Singapore. This multinational group found a significant decrease in liver clinic visits and the number of tests done by these clinics during 2020. Sadly, the main age group with the biggest contribution to this decline are mainly men and women over 65. This is the age group with the highest risk to develop a liver malignancy. Many in the medical field suspected that this is what is happening, and fear is driving people away from the care they require. Therefore, I ask of you, no, I implore of you, if you have any condition, any symptoms, be it medical or dental, please don't put it off. Get it started early to prevent irreversible or dangerous consequences. Thank you everyone for listening. Keep well and see you on the next video. Take care.